I'm Dr. Elliott Cleveland, physical therapist and founder of Marching Health. With this clinic, we have wanted to expand to meet the needs that band directors request of us. That includes the trifecta of physical skills and physical health in both directors and students, mental skills and mental health, and tactical skill sets that they may not have received instruction on in their music ed programs or even after. In order to do that, we have our doctors of physical therapy and our health and wellness team for Marching Health. We have partnered with Premier Sports Psychology to allow their top sports psychologists for the marching arts to join forces with us. And then also Mr. Michael Rosales, the leading choreographer for marching bands across the country. Band directors across the country have come to us wanting help addressing physical endurance problems in their students, lack of student leadership, or not having the proper movement knowledge to teach their students how to move safely and how to move well in the modern marching arts environment. We've also had many directors come forward and say they don't know how to handle conversations around mental health or mental resilience with their students. We're trying to meet all of those needs across the board in this one clinic package where we come in and have several schools come together, whether it's an entire school district or a bunch of local schools coming as one and getting all three of these things met at the same time. Our clinics feature a director track, which yes, does include director professional development credit. And the directors are educated on how to teach movement, how to explain movement in the modern marching arts setting, and how to do choreography that makes sense for your show design. We also talk to directors about engaging students in mental performance and mental health conversations. We teach them how to develop mental focus skills and empower their students with exercises to build their mental skills. Mental skills are just as, if not more important, than the physical skills of students. Most students say it's the mental focus and the act of being in the zone that helps them perform their best. So we want to equip them with the knowledge to do that so that they can take their performance to the next level. And then we offer our traditional marching health services that includes education on nutrition, heat, hydration, proper posture for marching and how it impacts us, how to recover from marching band days and competitions, as well as our marching band workout programs where we teach your student leadership teams how to run our dynamic warm-up system and marching band workout system that progresses throughout the season. This is not just a one-time deal. We make sure that the ensembles have knowledge on how to progress the programs. They have digital documents and videos where they have instruction after we leave so that they can continue progressing these systems throughout the season. We want to make sure that marching bands and band directors feel like they can go into their season equipped with all the tools and resources in order to have a more successful season and take their ensemble to the next level. Our goal is to take the latest and most modern work from sports science, sports psychology, and movement and combine those three into an all-encompassing clinic that's going to take the marching arts to the next level. We also use leadership training throughout our clinics. So we empower the student leaders to take ownership of developing and maintaining the movement skills that we teach them. They also learn our workout systems and they go back and they're in charge of teaching those back to their peers and running the first part of every rehearsal. So they get a chance to practice their communication and motivational skills. These are the exact same skills that transfer into their ability to lead and teach a sectional and lead your band throughout the season. Then they're equipped with the mental focus skills so that they can coach up their peers on how to perform their best and how to overcome things like performance anxiety in the moment. We also take time to help the student leaders cast a vision for their program this season. We want them to spend time reflecting on what their individual goals are as leaders, what their team goals are, and then how they can synthesize their thoughts and ideas into a very clear vision for the band this coming season. So we use leadership training, physical health and wellness, mental health and wellness, and movement to create an all-encompassing clinic to improve your band's performance. The students and directors at this clinic have come alive in the process of this. We make sure that our staff is world-class in education, and they're also excellent at building trust with staff and students. So in a very short time period, We have seen directors open up conversations about their personal health and wellness that need to be discussed so they can have a more fulfilling career. We've seen students be willing to talk about different struggles that they have gone through and give them strategies to overcome it. We've also seen them come out of their shells as performers and become an alive musician that knows how to move, knows how to lead, and knows how to step in as the future leader of their program. It's been a lot of fun to work with this group, and we've seen this all over the country where we are helping young people take command of their leadership and take command of their life so that they can have not just their best marching band season, but take these skills home with them and go on for a long time to come. A traditional marching health clinic incorporates student leadership training where we take your student leadership team privately, teach them communication skills as a leadership team, and we talk about what their natural strengths and weaknesses are and how to be able to take those strengths and magnify them as a leadership team and complement one another. Then we give them our workout system, our marching band specific workout system, so that they can take those communication skills we've discussed and apply them daily in your band program. The workout system takes about 15 minutes to do each day, and it has a rotation of different movement skills that they will need during the course of the year. They're gonna build their performance energy. They're gonna be able to play their instruments with more endurance from a cardiovascular perspective and be able to get more breath through their horn. They're gonna have better postural endurance so that they can stand tall and push through the weight of their instrument and lift up so their performance is a higher quality visually. We're also gonna bring in the full band and teach them all of these things as well, in addition to having conversations about nutrition, proper shoe wear, heat tolerance, hydration guidelines, and how to recover in between rehearsals that are done in team building activities, not lecture style, but engaging ways that get the students to understand these things on their level and be able to have practical moments where they can take this information and apply it right away. In addition to doing our traditional marching health workout systems and health education, we have added mental performance and mental health coaching. We have a sports psychology team that comes in and presents material that helps students overcome performance anxiety, build mental resilience, and equips staff and students to be able to talk about mental health. We want to make sure that your staff and your students are equipped holistically from a physical and mental health perspective so that they can optimize their performance in both areas and meet your needs and goals as a program. We've also added a movement component. We have a couple of clinicians that are equipped to teach both marching visual and marching movement, more of the modern choreography side of things. We want to make sure that we teach the workout systems that our marching health is known for that give students the foundation of strength, stability, and injury prevention that they need to be able to execute modern marching shows. And then we add on top of that the modern movement skills that bands need. So they have the physical stamina, the postural endurance, and the cardiovascular skill set they need. And then we incorporate the more challenging fundamentals and choreography that becomes second nature once these students have had our team come in and teach it to them.